Crossing the Quality Chasm, the title was designed to invoke some of what Rogers talked about, where innovations also have this chasm. And why? Well, the point was there were many health systems that were delivering high quality care in a thoughtful manner, but they were the innovators and early adopters, and that's where it tended to stop in our health system. And too many hospitals and too many health systems were not adopting what we knew to be best demonstrated practice or empirically demonstrated practices that would help save lives, improve the quality of care we deliver, and generally improve the work life of all involved. In this book, though, there's no EMR reference at all in an explicit sense. They do mention in passing, they have about 4 pages dedicated to clinical decision supports. And this was in 1991. And they were calling for, in 2001, everybody to have a computer-based patient record. So even the name is sort of archaic. But they were way ahead of their time. And this book continues to languish, and probably should. I mean, it's not truly relevant today, but there were certainly people who were thinking about it. And through none of this did the government, the federal government in most forms, act on the information. So who did start it? Well, somewhat surprisingly and out of left field when he announced it, the second President Bush in 2004 came out with an executive order. And if you read the wording of this closely, he says every American should have a personal health record linked to their health system by 2014. Now, stage 5 is what was going to be, by and large, meaningful use stage 3. The government has essentially put an end to the meaningful use program in the past 2 weeks, which is interesting in a number of directions. They've also made it so that the private practices that were in the medical group side of this can simply opt out almost in its entirety by, best I can tell, simply writing a letter and saying, I don't want to be part of it. So in a sense, the government's given up. And I'll be very curious to see how our models change going forward. But the other things to note are that stages 6 and 7 are not in any sort of technological time frame exceeding the old stage 3. So this is like everybody deciding that, you know, the rotary phone was okay. It does everything I ever needed for my information technology. And that's a very disturbing message. And it's also a message, we can look at the cumulative adoptions of these two, and from its peak back at the lower technology to its peak at the better technology, we get a gap of over 1,000 health systems. A third. So which 1/3 of the health systems are we going to be underserved in, delivering lower technological levels of information? It's not clear to me, and it's very disturbing. And I should suggest that this was built on a model prior to last week. I think that the government backing off of its programs to advance the technology would probably open this gap up even further in the near future. In conclusion, the government's efforts were long in coming. They could have started earlier, invested in research, invested in the Veterans Administration, which at one time had a very fine electronic medical record that had many of the characteristics that were desirable. It was open sourced, so people could look at how it functioned, emulate it, adopt it, improve upon it. None of those things exist in the current market for large integrated health system electronic medical records. When the government did get involved, it was a little late, and it was probably overmanaged. Simple rules would often drive better innovations rather than dictating a few very specific functionalities in the approach that was taken. And as it turns out, not all great ideas can be crowdsourced. And the good thing is, in the same way that the space race created plastics, integrated circuits, and other things that we live with today that make your mobile phones work, for example, and the glass, the needs for computer science, informatics, population health informatics, and the sorts of technological advances that healthcare needs to make function would have so much benefit in so many other sectors of our economy. It is just remarkable, and this would really be the next space race if you wanted to invest in an innovation and development area through science and better science. Thank you for your time.